destiny.
Hello, good evening, everyone. I hope everyone can hear me clearly. We can all use reactions, the chat box, the Q&A section for communication for now. I'd like to welcome you all. It's so good to have you here. So we're going to start with a quick introduction of who Markwish is, what does Markwish do, and we're going to introduce our today's facilitator, and I hope this is a beginning of a really interesting week for our implementation science webinar series. So to start with, can everyone hear
Hello?
me?
Hello, can you hear me?
Yes. So on behalf of Markwish College, I'm delighted to welcome all members that have joined us today from different parts of the world. I mean, we've gotten a great representation, we've gotten a great positive response, and it's truly an honor to have such a diverse and committed audience with us today. So to start with an introduction of Markwish. So Markwish College of Health and Allied Sciences is a health training institution that is based in Mwanza, and it's dedicated in building a competent and ethical and practice-ready health workforce through competency-based training. So we provide core programs that include clinical medicine, pharmaceutical sciences, and diagnostic radiography. So all these courses are designed to equip leaders with practical skills that respond to real-world health needs and system challenges. So at Markwish, we strongly believe that quality health training must be grounded in evidence, innovation, and continuous learning. So that's where our department comes, and that is the Department of Research and Innovation. And it exists to promote a strong culture within the college. So we support staff and students in conducting research, translating evidence into practice through different capacity building initiatives such as trainings, workshops, as well as collaborative projects. So as our department in research areas that we focus on, it includes health system research, infectious diseases, mental health, health security, as well as health diplomacy. So these are the thematic areas that we're focusing on, and the aim is to generate knowledge that informs policy, to strengthen service delivery, and to respond to the emerging and complex health challenges that are around both at local and global levels. So we therefore welcome any collaborations, partnerships with different institutions, researchers, and organizations that would like to advance evidence-informed health practice. So Markwish College of Health and Allied Sciences mission is to advance evidence-informed practice and innovation and strengthen health systems that improve population health. So our vision is to see that research and innovation actively shapes policy, practice, and training at both local and global levels. So I'd say that the implementation science webinar series is part of this mission. So what we aim is to provide and build that practical understanding of how evidence-based intervention can be effectively implemented, can be adapted and sustained in real-world settings. So we encourage all members to actively engage, to reflect on your own practice context, and also to participate in different discussions throughout the sessions in this week. So we would like to emphasize that this series is just the beginning. The department will be rolling out more trainings, more workshops, and more learning opportunities. And we encourage you to stay connected with us to receive different updates and announcements of the upcoming sessions as well. So finally, I would like to warmly welcome every one of you, and I really thank you all for taking time to participate in this training. Your presence here shows that you have a commitment to learning, improvement, and strengthening our health practice. So we look forward to a productive and engaging session together. So without further ado, before introducing our today's facilitator, I would like to give a small clarification with regard to the assignment that was shared during the weekend. So we've received a lot of emails of people inquiring why the form was closed, and the aim was because this assignment was intended for people to fill along with the sessions as they are ongoing and not before the trainings. So after today's session, then the assignment will be available for all of us to start now to reflect on the questions and see how relevant they are to the sessions right now and how they apply in our everyday settings. So on to introductions, I would like to welcome our today's facilitator, and that is no other but Professor Albino Kalolo. He's an associate professor of public health at St. Francis University College of Health and Allied Sciences, which is also known as FUCHES. It's in Tanzania. He has a diverse training in medicine, public health, with over 10 years of experience in research. So his area of research work includes epidemiology of infectious and non-infectious diseases, implementation science, primary healthcare, theory-based evaluations, and use of evidence in decision making. So in the course of his advanced training in public health, Dr. Kalolo received a Global Health Equity Fellowship from 2019 to 2020. And during this time, he worked to understand the influence of non-infectious chronic comorbidities on patient progress and quality of life among patients of HAART in rural Tanzania. Professor Kalolo is also an alumna of the Emerging Voices for Global Health and has published extensively in peer-reviewed journals on a range of topics relevant to public health policy and practice. So I would now like to welcome Dr. Kalolo, who will lead today's session, where we'll have a 60 minutes presentation, and afterwards we'll have a 30 minutes time for questions. So if you have any questions, then please feel free to write it in the chat box or in the Q&A box, and we'll address the questions accordingly. So welcome, Professor.
Thank you, Naima. As you already introduced me, I'm Professor Albino Kalolo from St. Francis University College of Health and Allied Sciences. But also I work with an organization known as CERIHI, or Center for Reforms, Innovation, Health Policies, and Implementation Research. Yeah, so at CERIHI, I work as a senior research scientist, while at SFUCHES, or St. Francis University College of Health and Allied Sciences, I work as an associate professor in the Department of Public Health. Yeah, so that is in a nutshell about me, and my research is mainly on implementation science, something that we will discuss in 1 hour or 1 hour and some minutes. Yeah, so I would like a support from Naima to share my presentation, because I can't share from my side. I don't know what is happening, but you can share the presentation so that I proceed with the presentation. Thank you.
Thank you, Professor. I'll be sharing it in a few minutes.
Okay, thank you. Yeah, so our topic today is the foundations of implementation research. Yeah, so we will be touching base on what is implementation science, the core principles of implementation science, but later on we will discuss about implementation research, or the research that uses implementation science methods. And then you will distinguish between implementation research and other types of research. And you also will touch base on formulating research questions for implementation research. And the last topic will be on evidence-informed implementation. Yeah, so those are the issues that we are going to cover in this presentation. Yeah, so what is implementation science? So implementation science is actually an emerging field, and currently there exist many different definitions. But those definitions, some are focusing on closing the gap between what we know, it means from research or the evidence that exists, and what we do, the practice. And actually focusing on whether the findings or the research findings we have or the evidence that we have, is that evidence actually reaching the practice? Yeah, so that is one of the focus of implementation science. But also others, other definitions, they emphasize on creating solution that can be easily adjusted to work well in different places. Yeah, so translating evidence to other places, or we call lesson learning, that you have something that works in this context. Will it actually work in other context? Yeah, so those are the focus when it comes to defining implementation science. But there are some definitions that have already been agreed by some researchers. For example, Glasgow and colleagues in 2013, they define implementation science as an application and integration of research evidence into practice and policy. Yeah, so if you integrate the evidence from research or something that you have discovered and then it's taken to real practice, that is implementation science. But Atole and colleagues also says implementation science is an applied research that aims to develop the critical evidence base that informs the effective, sustainable, and embedded adoption of intervention by health systems and communities. Yeah, so you see all of the definitions are focusing on research evidence or existing evidence, taking it to the real world settings, impacting people's lives or leading to health outcomes. But also Peter's implementation science is a scientific inquiry into questions concerning implementation. Yeah, so in their definition, they are saying that implementation science should focus on implementation, the act of carrying an intention into effect, which in health research can be policies, programs, or individual practices, collectively called as interventions. Yeah, so you see, it's all taking something into real practice. Or is a scientific study of methods to promote uptake of research findings. You have an evidence. Now you want that evidence to be in routine practices in the healthcare settings, could be in the clinical or in an organization or in the police context. Yeah, so in a nutshell, that is how implementation science is defined. But you clearly see that we are talking of evidence, and later on we are talking of practice, whether there is a connection, whether there is no gap. But of course, we already know that sometimes you could have an evidence, but it's not taken into real practice for even quite sometimes because of some barriers that exist in the real world settings. Okay, so implementation science involves innovative approaches to identifying, understanding, and overcoming barriers to adoption, adaptation, integration, scale up, and sustainability of evidence-based programs. Could be programs, or could be tools or policies or guidelines that have already been tested that they can work. Now we use implementation science to actually take those evidence-based programs in real practice, but also we look at the barriers or even facilitators to adoption, adaptation, integration, or scalability, or scaling up those interventions. So, in fact, the main question is how we get what works to the people who need it with greater speed, fidelity, efficiency, quality, and relevance, relevant coverage. Yeah, so that is implementation science. So it seeks to systematically close the gap between what we know and what we do, often referred to as an implementation gap, by identifying and addressing the barriers that slow or halt uptake of proven health intervention and evidence-based practices. So implementation science-based research starts with the evidence-based intervention. So you have an intervention which is already, there is already an evidence. For example, vaccination. If we talk, for example, of COVID vaccine, we know that after COVID, there was a discovery of a vaccine. Now we want to take this vaccine to the people. Now, what are the issues of making sure that there is uptake of COVID vaccine? You see that there are several issues, there are several barriers to making sure that this is the vaccine is taken. Yeah, so a vaccine, a COVID vaccine, for example, is one of the intervention, or it's one of the evidence-based intervention that has to be taken into practice. But there are several other evidence-based could be programs or practices, products, pills. Sometimes you have a certain pill that is supposed to be taken real practice, or policies. Yeah? In implementation science, we call these the 7 Ps. Procedures, programs, product, policies, pills, practices, principles. So these are the ones that we are, focusing on taking them into real life practice. Okay. So what is not implementation science? You know, when we are talking of implementation science, we have also to distinguish with other things or other programs or other things that maybe happen in the healthcare settings or in any settings, but we may be confused with implementation science. So implementation science is not business as usual health research, because we conduct a lot of research, but of course, the aim is not taking evidence to practice, but sometimes it's just discovery. So that is not implementation science. Or quality improvement. Sometimes you have a specific program to improve quality, a quality improvement program. That is one is not implementation research, because it's local and specific. It's not like actually aiming at bringing close the evidence and in the practice. Dissemination, just spreading what you have found. That is not implementation research. Program evaluation. is not per se implementation research, even though, yes, at one point you could use some program evaluation methodologies in implementation research, but just program evaluation, be it formative or summative, is not implementation research. Yeah, if you have question, you can write in a chat, or you could even raise your hand, and we will actually respond to the question. Okay, so what are the core principles of implementation science? First, you have to understand the intervention that is supposed to be taken into practice, an evidence-based intervention. The example of maybe COVID-19 vaccine is already an intervention. It's evidence-based intervention. After several clinical trials and whatever, we have seen that this works. So you have to understand it first. And later on, understand the implementation strategies. How can it be taken to real practice? And then understand the context. Where? What are the issues? What are the barriers? What are the facilitators? What is the exact context? Sometimes, I mean, you have to understand if the health system, is it a fragile health system, or is it a system that is well organized or something like that? You have to understand that. And then you have to understand the outcomes. What are the outcomes at the end? Okay, so when it comes to the intervention, you need to understand how the intervention works. You need to understand which strategies can be used to take this intervention real life practice. Do you need training first to make sure that people implement that intervention? Or if the beneficiaries of the intervention, do they know that intervention, so that later on there is a good uptake of that intervention? But later on, which implementation outcome? Do you want that intervention to be adopted? Do you want it to be implemented well in, the fidelity of implementation? Are you focusing on acceptability, whether it's acceptable, or are you focusing whether that intervention, even if it's already uptaken, is it sustained over time? Yeah, so those are the key issues that we look when we are conducting implementation science research. Okay, so now, what is implementation research? We are defining implementation science in general, but any research that uses implementation science methods, we call it implementation research. Yeah, so implementation research is a systematic approach to understand and address barriers to effective and quality implementation of health intervention strategies and policies. Yeah, so you are using the implementation science methods to make sure that you understand and address the barriers, sometimes even facilitators to implementation of the intervention. So implementation research is important for designing strategies or solutions to overcome bottlenecks that prevent proven and innovative public health intervention from reaching the people who need them. Implementation research focuses on understanding and closing the gap between evidence-based intervention and practice. Okay. Next slide. So, Naima, can you go to the next slide?
Apologies. I think something happened.
Okay, so maybe any reaction while Naima is fixing the presentation, any reaction? Maybe you raise your hand and then I'll respond to your question. Or you write in the chat. Emmanuel?
Prof, we're back. So I think I would advise for them to write the questions in the chat box for now. Then we're going to allow the mics after the presentation.
Okay, thank you. Yeah, so the key elements to evaluate include the design of the intervention itself. So because we said in implementation science, first we have to understand the intervention itself. Yeah, so how is the intervention designed? Is it a simple intervention or a complex intervention? Some intervention have multiple components, so they are already very complex, and you have to take them in a very complex environment. So you need to actually understand the key components of the intervention. But also you have to know the contextual barriers, the context. Do you have enough human resource for health to take that intervention into real practice? Do you have the finances? Can you monitor whatever is going on to check whether the intervention is taken in real practice or not? Yeah, so you have to check the various issues that could affect the uptake of the intervention. But also which strategies could help you implement that intervention, as well as the achievement of the intervention outcomes. Later on, you want to assess whether this intervention is adopted, is accepted by the beneficiary community, but later on, whether the implementers were implementing in fidelity. Because all these implementation outcomes later on will be linked to the health outcomes. If we are focusing of health outcomes, for example, for the COVID vaccine, we want to reduce maybe the COVID disease. So it means you will not get many patients, or for any vaccine. Yeah, so because at the end of the day, if you don't find that there is any improvement in health outcomes, you might say that maybe the intervention is not effective, but you are forgetting that this intervention was not actually implemented. Yeah, so the importance of evaluating implementation outcomes is to see whether the intervention was actually taken into practice before concluding that whether it's working or it's not working. Yeah, so implementation research or implementation studies look at understanding and addressing challenges of translating evidence-based intervention into policy into real-world practice within the health system. This research often involves multidisciplinary approaches and participatory methods. So you need people from different disciplines. Some understand the research methodologies, some are experts in the intervention itself, but also use participatory methods such as mixed methods. Sometimes you could use qualitative approaches or quantitative approaches or mixed methods to actually understand what is going on in diverse settings. And actually you want to understand the processes of implementation. You want to understand the mechanisms under which those interventions are being implemented and leading to the actual outcomes. And you have also to check the reaction of the different stakeholders, whether those stakeholders are accepting that intervention or there is a resistance and what is causing that resistance. The next slide. Okay, so most of the time, implementation research is demand-driven, with the research question framed on the basis of the needs identified by relevant stakeholders, implementers working together in the health care system. Yeah, so it's demand-driven. So implementation research, because we want to bridge the gap, so they will actually come with research questions which are aiming at maximizing implementation outcomes and later on leading to the health outcomes of the population. Next. Yeah, so why are evidence-based intervention not working in real-world practices? Most of the time, there are several issues that could actually tell you why the intervention didn't work. First, you have to be sure whether the intervention was the right intervention for that specific population. Sometimes you have intervention that is actually a wrong intervention. For example, you are targeting maybe adolescents, and then you come with an intervention that has contents that are related to the adults. Yeah, so that intervention will actually not work to that particular population. For example, if the health education, you are focusing on maybe changing some behaviors, but the strategies that are within that intervention are for adults and not for adolescents, so that intervention will not work. The intervention was not delivered as a plan. Sometimes you have planned that you will deliver this specific package, and that package is not delivered in that way. So that intervention will not work. Wrong strategies were used to implement the intervention. Sometimes you use wrong strategies. Instead, maybe of using some modeling approaches, you use other approaches that are actually not working. Or you had a correct strategies, but those strategies were poorly implemented, so you don't expect to get results. Or there were previously existing barriers which you didn't address. Cultural distrust, for example, weak support systems, or new barriers. For example, COVID pandemic could have, hindered some interventions to actually be implemented in fidelity, or making sure that these interventions reach the communities. Yeah, so that is in a nutshell why some interventions do not work. So sometimes if there is an intervention, implementation failure, you don't expect the intervention to work, even if it was a very good intervention. So there is no problem with the intervention, but there was no implementation at all, or the implementation was very suboptimal. You don't expect that intervention to work. So we call it implementation failure, or type 3 error, that there is an error when it comes to implementation. So now how can we distinguish implementation research and other types of research? Yeah, so for the basic research or clinical research, most of the time the aim is to develop new treatment or tools, where implementation research is to integrate the existing tools into routine practice. So things that were developed by basic or clinical research, implementation science or implementation research takes those tools into actual practice, so that the population can benefit. Clinical research, most of the time, is conducted in labs or clinics or in a very controlled environment, while implementation research is in real-world settings, the communities, hospitals, schools, or something like that. Measures, most of the time, in clinical basic science research, we focus on statistical significance, the purity of data, where in implementation science, the issue is sustainability. Can we sustain whatever we are measuring now? Scalability, equity, something like that. So those are the measures that at the end of the day are considered. The research subjects, most of the time in basic research, is specific patients, and sometimes we have strict inclusion, exclusion criteria, but in implementation research or implementation science research, the focus is healthcare providers, the implementers, but policymakers and the public, the beneficiaries of that specific intervention. And the timeline for basic or clinical research often takes years to move from bench to bedside. But implementation research is an iterative and ongoing to fix the various bottlenecks in the healthcare system. Yeah, so that is in a nutshell how you can distinguish implementation research and the other types of research. Next. Okay, so you can see this is, I mean, the pictorial illustration on the pre-intervention, or is there any relationship where we are looking at the statistical significance and whatever. And then we have efficacy studies. Could this program work? Effectiveness studies. And after effectiveness, then we take it to actual implementation in the real world setting. What makes the program work in practice? Yeah. Okay, next. Okay, now how do we actually formulate research question for for implementation research? In basic sciences, for example, you could say, what molecular pathways does this vaccine trigger? So you are interested with the mechanism, how the vaccine works. In a clinical trial now, we want to see whether does this vaccine reduce infection rates at least 80%. We are checking for efficacy, effectiveness. But in implementation research, you already have that evidence, which was already discovered during the clinical studies of clinical trial. Now, how can we train local staff to maintain the -70 centigrade cold chain required to store this vaccine in a tropical climate? Yeah, you want this vaccine now to work, and one of the conditions is that this vaccine should be stored in the cold chain, and you have seen that usually this is not happening, and this vaccine is actually not working. So implementation research is responding to such questions, because that is like a barrier to make sure that that vaccine works. Yeah, so it's one of the questions. We go to the next slide? Yeah, so when you are formulating research questions for implementation research, you have to actually focus on which aspect are you investigating. Could be processes of implementation. You are assessing the implementation processes. So the question could be, how exactly is the intervention being put into actual practice? So you want to understand those processes. For example, after discovery, what was the next step after discovery of the vaccine? So maybe it was disseminating the findings. Later on, meeting with the policymakers and advocating that now we have this new discovery. Now, after advocacy, what followed? Maybe now meeting with the Ministry of Health officials, meeting with the implementers, training the implementers, making sure the intervention now is taken to practice. So you want to understand the processes. But another aspect could be that you want to understand how the intervention is being implemented, the performance, fidelity of implementation. Is the is the intervention being implemented the way it's supposed to be implemented? That is called fidelity of implementation. So your research question could be just focusing on adherence to the program protocol or to the program guideline that to implement this intervention need to follow these steps 1, 2, 3, 4, 5, 6. Yeah, so you are interested to find out whether those steps are being followed. That is fidelity of implementation. Or preferences. Do the providers and patient actually like or accept the intervention? So is stakeholders' reaction, responsiveness to the intervention. Yeah, so you want to understand that. But also, we want to understand the costs. Is the solution affordable or sustainable for the local budget? Because this could be one of the very important barriers to implementation. Partners, who are the stakeholders? Are they cooperating? Or some stakeholders are not actually cooperating? Because this is one of the issues that will help this intervention to be implemented. Propensity, what is the readiness of the organization to change? Sometimes you want to implement a certain intervention, but the organization is not prepared. I mean, with its people, with its resources is not prepared to change. So the change management to make sure that this intervention at the end is implemented. Do local or national laws support or hinder this work? You have also to check the existing policies, the existing laws. Are they supporting, or there is a total barrier for this implementation for this intervention to be implemented? So you have to assess these issues. So most of the implementation research questions focus on these 7 issues. Next. Yeah, so now what are the steps in formulating the the implementation research question? First, identify the intervention in question. What is the intervention which you want to conduct a research? So before you can ask an implementation question, you must have a proven intervention. This is an evidence-based practice you want to put into practice. You need to know it. Second, identify the implementation gap. What is the problem? After identifying that gap, then you can formulate your question. So where is a leak in the system? You need to observe the real world setting to see where the process is failing. Maybe you have noted that people will need more skills so that they can implement your intervention, or to accept, or maybe there is a lot of misinformation or disinformation about that intervention. So you want to understand the misinformation and the disinformation so that you can reshape the strategy. So, but you need to select an implementation framework. Usually there are some frameworks that can guide you to formulate research questions. I think we will discuss tomorrow about the various frameworks that can guide you to actually design research questions rather than just using common sense. Step 4, define the implementation strategy. This is the how. Your question should focus on the strategy used to overcome the gap identified in step 2, because we said you need to identify the gap, but that gap, how should it be implemented in real practice? Choose your implementation outcomes. Are you addressing, do you want to understand the adoption, Do you want to understand acceptability? Do you want to understand maybe sustainability or reach or something like that? Tomorrow we'll discuss about one framework which is called the Proctor Outcome Framework. And then this draft the question itself, the research question. Next. Okay, so a standard research question for implementation research is focuses on strategy plus intervention plus target population or setting plus outcome. For example, how can we improve TB testing in Tanzania? We want to do some improvement because tuberculosis, I mean, is a problem, and there are no ways to actually test that disease, but testing has not reached everyone. So our focus is to improve that. Or does training necessarily improve TB testing? That is an alternative. Or the final one is, to what extent does mentorship-based training strategy affect fidelity? Fidelity is an outcome, implementation outcome of point of care TB testing, the intervention among rural dispensary staff in the Dodoma region, for example, in Tanzania. Yeah, so your research question should be comprehensive, focusing on the strategy, the intervention, the target population, and the outcome that you want to achieve at the end of the day. Okay, next slide. Okay, so I will go to some case studies on the research that I participated, implementation research. For example, there is this study where we wanted to understand whether improved community health fund is actually taken into real practice. We understand that in Tanzania, there was something called Community Health Fund, which uses the idea that community-based health insurance can accelerate to universal health coverage. But it was found that less than 10% of the population are subscribed to the community health fund. So there was an intervention which was designed to actually improve that situation, which is called improved or redesigned community health fund. Next slide. Yeah, so in this study, we wanted to understand the factors that are affecting adoption, implementation, fidelity, and sustainability of the redesigned community health fund in Tanzania, where we used mixed methods study to actually understand the implementation processes in the Dodoma region. Yeah, so like what I said, you need the intervention, but also you need to find out which implementation outcomes are you focusing. But a methodology, like here we use the mixed methods, which is more participatory. Yeah, so this is one of the case studies in Tanzania. You can find this paper, and if you want to understand more what we wanted to investigate. So this was a study protocol. Next slide. The second case was in the same intervention, the improved or redesigned community health fund. But here we want to understand the stakeholders' reaction, because sometimes the intervention doesn't work because the stakeholders do not accept the intervention. Yeah, so our question were, are stakeholders like to accept this intervention? What are the stakeholders' concerns about this intervention? Yeah, so that is a type of implementation research. Can you go to the next slide, please? Yes, so we published this paper where we conducted a qualitative study of views from the rural communities. What are they saying about the community health fund? Is it well implemented? Is it well designed? Is it meeting their expectation or something like that? So from there now we can devise implementation strategies that can maximize the uptake of this intervention. The next one. Case 3, we wanted to understand the implementation processes and effects of the intervention. It's not only the processes, but we want to link with the outcomes. So we had a program called Direct Health Facility Financing, where funds are disbursed direct to the health facilities and bypassing the other levels like the regional level and the district level. Now the money goes direct to the facilities. Now we want to find out whether this intervention is actually taken into real practice and whether it's leading to some effects that we wanted, that when people receive money direct at the health facility, they have more autonomy, and also there is no leakage, unlike when the money is sent at the district level. Sometimes disbursing to the health facilities, there are leakages and there are some problems. So we wanted to see whether this is working. But another intervention was data use initiative in primary health care facilities. We want to see whether data is used in primary health care facilities in decision making. So our aim was, what are the implementation outcomes and what is the effect of the intervention? We are linking implementation outcomes and the program effectiveness. Next. Okay, so this was one of the protocol that we published, and later on we even published some papers on this paper. We wanted to understand the implementation of the direct health facility financing and in its effects on health system performance in Tanzania. So you see, you could use different methodologies. Here we used a non-controlled before and after mixed method. It's a mixed method, but because it's an intervention, we want to know the before and after. Before the intervention, after the intervention, are there changes? While we are also investigating whether there was fidelity of implementation and whether there is adoption and whether the processes are sustained over time. Next. Hello, next. Okay, so the next was on data use, the data use initiative. Even this was implemented in the primary healthcare settings in Tanzania. And we used a before, after mixed method study to understand the implementation processes, but also the effects of the data use initiative in the primary health facilities. Naima, are we together?
Yes, Professor, we're together. Hello,
okay.
Yes, we can hear you.
Yeah. Okay. Take me to the next one, because I have already explained about this one. Yeah, case number 5, we wanted to understand the implementation process, and so that we understand how we can scale up a program. This was on the removable injectable modified short course regimen for expert multi-drug resistance TB. Yeah, we want to remove injections, especially for multi-drug resistant TB. So we wanted to understand the implementation outcomes and later on check how we can scale up that one. Next slide. Hello. Yes. Yeah. So this was published in BMJ Open, implementation of the removed injectable modified short course regimen for expert multi-drug resistance TB, the RISE study in Tanzania. It was a protocol for mixed methods process evaluation. Take me to the next slide. Okay, so another important aspect when it comes to implementation science is evidence-informed implementation. So implementation science is fundamentally concerned with identifying effective strategies for implementing evidence-based intervention. But you need also strategies that are evidence-based. Therefore, it is critical to understand the difference in what it meant by implementation strategies and evidence-based intervention. The intervention you are implementing is evidence-based, but also you have to use implementation strategies that are informed by evidence as well. In that way, you will be implementing evidence-informed implementation. Then next slide. Yes, so evidence-informed implementation, to be truly evidence-informed, an implementation strategy must balance three types of knowledge. Research evidence. What does the formal science say? But also practitioner expertise. What do the people on the front line know? It means at one point you need to train them. Our nurses are overworked. A 5-step protocol is too complex for them. So you have to know something that I touched sometimes, that some intervention are very complex. So even the implementation strategies should look at those complexities and actually address those complexities so that the practitioners can implement that intervention well. Contextual or lived experiences. What is the reality of the setting? For example, the community distrusts outside medical advice due to historical factors. So there should be strategies that actually address that issue. Okay, the next. Okay, so thank you for listening. And this marks the end of my presentation. But the next slide is for your feedback. Yeah, so Naima, don't know how you coordinate the questions or the... Back to you, Naima.
Thank you very much, Professor. Thank you so much for delivering a wonderful session. I believe we grasped a lot of things to help introduce us to the concept of implementation science. So we had a few questions that were already in the chat box. So I think we'll start with the first questions. There are about 5 questions that were in the chat box. And once these are addressed, then we're going to now allow mics for a couple of people to ask questions. And we know we cannot address all questions in time since we only have about 30 minutes left. So if there will be questions beyond 6:30 that will still be pending, then we are going to use our WhatsApp group to address the questions. So I'll share, we'll share a different screen to show the questions. But the first question, Professor, was asked by Desi Abebao. And the question asks, can we conclude that the primary target for implementation science is focusing on strategies for intervention? I'll repeat the question. It asks, can we conclude that the primary target for implementation science is focusing on strategies for intervention? Yeah, Professor, if you can address that.
Yes.
Professor?
Sorry. Yeah, so there was a problem with my network. Yeah, so what we said is that for implementation science, you have first to identify the intervention. So you need to understand well your intervention. Is it a simple intervention? Is it a complex intervention? And then understand the strategies which can take that intervention in real life practice. Yeah, so understanding the strategies is something else and very important and is a second in the continuum of implementation. But only understanding the strategies without understanding the context, then you will not have completed the cycle. So after understanding the strategies or identifying the strategies, you have to understand whether these strategies can work in that given context or in different context. And later on, you have to select your implementation outcomes. Are you focusing on adoption? So you will have different strategies for adoption and in a different context. Are you interested with the fidelity of implementation? So you will have different strategies to make sure that people implement your program in fidelity. Yeah, so it's not only strategies. Yeah, it's understanding the intervention itself, looking at the strategies, looking at the context, understanding which implementation outcome you are focusing at the end of the day. I hope maybe it's clear. If there is something that is not clear, you can still follow up. Thank you.
Thank you very much, Professor. I hope it was well addressed, and if not, they'll definitely follow up. The second question was from Emmanuel Chilese, and he asks, are implementation researches limited to any specific research methodologies? Are implementation researches limited to any specific research methodologies?
Okay, thank you. I can say that maybe it's not limited to any research methodologies. Like I think I indicated that most of the time we use the participatory research methodologies because you want to, because there are several barriers that will actually be understood maybe by using qualitative research. Qualitative research most of the time is very participatory. It means you interview the participants, the implementers, different stakeholders. Yeah, so most of the time you could see that methodologies like the qualitative approaches have been very helpful. But sometimes you need also to quantify fidelity. You could design a fidelity questionnaire or a fidelity index where you want to actually know the level of fidelity. What was the level of fidelity in implementing this intervention? You want to know what was the level of adoption. Was it adopted 100%? But you also want to know whether there was some modification, adaptation. Yeah, so you want to know the percentage of adaptation. If you have an intervention and then the adaptation goes more than 70%, so it's a different intervention, then it's not the same intervention. So you can use now the quantitative methodologies to understand that. But sometimes you mix the methods. There are some questions which can be responded well using the qualitative approaches and some with the quantitative approaches. So you use the wisdom of both, quantitative and qualitative, and at the end of the day, I get a holistic picture on the implementation processes or the implementation outcomes of this particular intervention. Yeah, so it's not limited to any specific research methodologies. You can be flexible depending on the your research question. Thank you.
Thank you very much, Professor. The third question is from Yasir Al-Hassan Muhammad, and he asks, are there any similarities between basic research and implementation research? Are there any similarities between basic research and implementation research?
Thank you. Yeah, so because in basic research is also a research that follows stipulated procedures for any scientific research or scientific inquiry. So even implementation research follows the same basic procedures for research. But what is the difference is the focus. As already I said, that basic research is aiming at discovering something, while implementation research is taking that something that is discovered, is taking it into real life practice so that it affects the population, improves maybe health outcomes or something like that. Yeah, so maybe that is the difference, but all of them are research and they follow the basic procedures that you should have a hypothesis or should have a research question. You should use certain methodologies. You will have to analyze data. So they follow the similar research procedures, but the focus is different. That one is for discovery, and the other one is for taking the discoveries in real practice, in real world practice, so that things can happen.
Thank you very
Okay,
much.
the next.
Yeah, so the fourth question is from Langu Vanessa. She says, can we say implementation research is a fundamental step for policy or national guideline formulation in healthcare systems? Or would this not work on a national scale and need to be specific for regional or even community levels, depending on available resources, access, and reach, and other barriers that may be identified?
So, implementation research, like what I said, you already have something that has been discovered or has been formulated, and you want to take it into real practice. But the same could be improved depending on the reaction. For example, you have a guideline, which is already an evidence-based guideline or evidence-based protocol that you want it to be implemented. Yeah, so in the course of implementation, for example, if it's failing, for example, you could adopt or you could do something. So we can't say that implementation research is fundamental step for policy formulation or whatever, but the policies we have are supposed to be taken in real practice by implementation research. But the formulation of the policies or formulation of the guideline, you remember I talked about the 7 Ps. Yeah, so the policies, procedures, and whatever, those are evidence-based programs or whatever that are supposed to be taken into practice. But if you take it in practice and then you see there are some failures, so you could even come back and inform those who designed or those policies and say that probably this is not working. But implementation research doesn't aim to formulate policies or formulate guidelines, formulate interventions or whatever, but take the intervention into real practice. Are we there?
Thank you very much, Professor.
Okay.
Yes, we're there. Yeah. So the fifth question was from Victor Hanson, And he asks, what type of implementation frameworks are used in implementation science or implementation research?
So we have different frameworks, which for sure we will discuss tomorrow. So there are some frameworks that helps you to understand the implementation outcomes, but there are some frameworks that helps you to understand the context. So, but there are some other which helps you to understand the implementation strategies that can maximize the outcomes. Yeah, so there are several frameworks which for sure in the tomorrow's presentation we will cover one by one and we will group them so that you understand, because there are several implementation science frameworks. Thank you.
Thank you very much, Professor. I think we'll now allow a few participants to ask questions. So the first hand was raised by Kazim Abdul Ganiyu. If you're able to speak, I'll allow your mic for you to address your question. Kazim?
Okay, thank you very much. Thank you very much, Naima. This is Kazim Abdugania. And thank you, Prof, for the presentation. From the beginning of your presentation, you mentioned that quality improvement is not implementation research. And I was wondering where we should draw the line between quality improvement and implementation research. I'm saying this because I've done this for a while. And before we could do quality improvement, the first thing we normally would do would be to check those interventions that are not working. So we look at, we do root cause analysis and end up by fixing a particular intervention, just like you said. And that intervention will be monitored to see how the outcome is being achieved. So I really want to understand where we should draw a line between quality improvement and implementation research. I don't know if this is clear, Prof.
Thank you. It's very clear. Yeah, so like what I said, in implementation research, you have a specific research question to respond to. But in the quality improvement, it's not necessary that you have a specific research question, but you could have maybe a local aim. And even when you address something, it's even very difficult to even generalize, because the quality improvement is for that specific intervention, or for that specific item that you found that it was not working, and then you have designed a local strategy to actually address it. But when it comes to implementation research, you have a clear research question where you have intervention, you have the strategies, you have identified maybe some barriers or some facilitators, and then you have an outcome, which could be adoption, which could be acceptability, could be fidelity, or could be whatever. So implementation research or implementation science methodologies, more broad, more robust, and probably not fixed to that particular intervention. Yeah, so quality improvement approaches are for a specific intervention and for specific issue that you have, you are targeting. Yeah, so in a nutshell, that is where you can actually draw a line. Thank you.
Thank you very much, Professor. I'll now allow George to address your question. George. If George isn't available, I'll allow Miriam Konto to address your question. Miriam? If Miriam isn't available, then Boniface. Boniface. Ifeolua.
Hello, everyone. I hope you can hear me.
Yes, we can hear you.
Okay, thank you so very much. This is really very helpful for my work. Thank you so much, Prof, for the presentation. I just want to have a clarification. Just like I said, earlier on, is help for my work, my PhD work that I'm currently working on. I'm trying to look at a policy, so to say, a cancer head fund policy. So while Prof was presenting, so I was just trying to follow at the same time go along with my work. So when he was talking about we identifying an implementation gap, more or less look at a leak or a gap probably around the policy or the health intervention or whatever. So, and at the same time, when he talked about implementation strategy, he said strategy used to overcome the gap. So I need a clarification. Take, for example, I'm evaluating that policy on cancer aid fund. It's a policy in Nigeria. And the gap I discovered was that the policy is only obtainable in one state, in one hospital, so to say, in the state I'm looking at. And so that's the gap. People could not access it. So I'm not clear on the implementation strategy. Is it on the part of the stakeholders or on my part that I'm going to look at the strategy they ought to use to overcome the gap, or which one? I am not clear. I don't know if Prof understand my question. Thank you.
Okay, thank you. I don't know whether I followed you well, but I will try to respond the way I understood. So you said there is a cancer policy, and that policy needs to be implemented. And what you found is like it's only implemented or available in only one hospital. Yeah, so when it comes to policy implementation, it means there should be several strategies to make sure that this policy is taken into actual practice. Now, taking the policy to actual practice could be by training people, means training the healthcare providers, but also financing the policy itself, making sure that there is some funds to make sure that there is training, there is various materials so that you reach the stakeholders. Yeah, so those are the implementation strategies. But for you, if you are evaluating whether this policy has been implemented or not, it means you have first to understand the policy itself, understand the strategies which were used to take this policy into actual practice, understand the reactions of the stakeholders, and later on you can conclude why is a policy failing. Is it because the policy itself is a weak policy, or it's because the implementation strategies which were used to implement this policy didn't work? Where is the problem? Yeah, so that is a role of an implementation researcher, understanding things that didn't work until maybe this policy didn't work well, or it was not taken in real practice. I don't know, you can come back if something is not clear yet.
Yeah, very clear, Prof. It was really helpful. Thank you.
Okay, you are welcome.
Thank you very much, Prof. We have about 7 minutes left, so perhaps 1 or 2 last questions, and the rest will be addressed through the WhatsApp group, and we'll seek guidance from our professor. So, Simon Peter, if you can unmute your mic and address your question.
Thank you. I don't know, am I heard?
Yes, we can hear you.
Okay, thank you so much. And thank you, Professor. I have 2 questions. One, I just want clarity. Do we want, say, implementation research actually focuses on how already existing policies or standards are being implemented or adhered to its fidelity? And then 2, what if I do want to investigate? I'm giving it as an example. I want to investigate maybe in a ward, there is increased number of patients that are developing sepsis, and I want to investigate what could be the problem. Will that fall into the implementation science, or it will go into the other basic science? Those are my 2 concerns.
Thank you. Yeah, if you have noted that there is an increase of maybe a certain infection in the wards, while you have an intervention that is supposed to actually prevent that, then you could check whether that intervention, what is the problem with that intervention? Is that that intervention is not enough to prevent those infections, or the intervention has not been implemented according to make sure that it prevents those infection. Yeah, so that could be implementation research. But later on, you have discovered that everything is working well. The intervention is intact. I mean, the intervention can prevent that infection and is being implemented accordingly, but still there is infection. In that way, now it's a discovery research. You want to discover why. Maybe there is a resistance or there is whatever to the already working intervention. So that is a discovery research now. Yeah, so you see, you can use the implementation science approach, and later on, if you see that everything is working well, the intervention was implemented and everything works well, but still there is a problem, then you have now to discover. Yeah, so there is like a continuum from discovery research to implementation research, and then discovery research or basic science research, something like that. So there is a continuum. One informs the other. Thank you.
Thank you very much, Professor. Unfortunately, we're running out of time, and so if your question was not addressed, I'd kindly ask for you to address it in the WhatsApp group, and we'll request Professor to help address those questions so that we all have a proper understanding of the concept, but also help us as we move forward with the upcoming sessions this week. Professor, I'd like to really thank you for your wonderful session, for addressing all the questions that were asked. This was really great, and we really appreciate your willingness to equip us with knowledge about implementation science. We are really grateful for that. And with that, I'd like to conclude today's session, and I would like to thank all participants that were able to join today's session, which I hope has been an eye-opener and has been a better introduction for you all to the concept of implementation science. Tomorrow will be our second day in this series, and again, we'll be with our our great Professor Kalolo again. So we look forward to tomorrow's session and the upcoming sessions as well. So I'm going to address a few things before closing. The first is all the recordings for these sessions are going to be shared for easy follow-up, and the presentations will be shared as well. And with regards to how to join the meeting, I understand there has been challenges with a couple of people in joining the meeting. We kindly advise you to start registering to the platform earlier to avoid any challenges, to make sure you familiarize yourself with Microsoft Teams so that you do not get any challenges when joining the session. Otherwise, I would like to thank everyone for attending, and we'll see you tomorrow at 5 p.m. East African time again. Thank you very much, and I wish you all a wonderful end of your day. Thank you.